Have you ever wondered if that cramp you felt in your leg was actually something more dangerous? Well, if it's happening often, it might be time to check in with your doctor. But not all cramps are created equal, and they don't always mean that there's an underlying issue. So let's talk about what causes cramps and when you should see your doctor for them. I'm a doctor, an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series is designed to help answer some of your medical questions and the questions that come up every day. If you find this video helpful, please do me a favor and subscribe. Muscle cramps can happen for a variety of reasons. They can be caused by dehydration, overuse of a muscle, or nerve compression. The most common type of cramp is called a Charlie horse, which usually occurs during exercise and affects people of all ages. The good news is that Charlie horses aren't usually serious and typically resolve on their own within a few days. However, there are other types of cramps that could be a sign of something more serious, such as vascular problems or blood clots. Vascular cramping is caused by poor blood flow to the muscles and can be a symptom of peripheral arterial disease, which is a condition that occurs when there is a blockage in the arteries that supply blood to the extremities. This blockage can cause cramping pain when you walk or exercise, because your body isn't getting enough oxygenated blood to those muscles. Blood clots can also cause cramping pain, especially if they occur in the lower leg veins. This condition is called deep vein thrombosis, and it can be serious because clots can travel to the lungs and cause a pulmonary embolism. So let's go over the different types of cramps and what causes them. We'll start with the most common ones and work our way down to the more serious ones. First, we have benign fasciculations. These are the most common type of muscle cramps, and they're usually harmless. They can occur at any age and often happen during or after exercise. Benign fasciculations typically resolve on their own within a few days, but you can also try some home remedies to help speed up the process. Staying hydrated, getting enough electrolytes like potassium and magnesium, and getting plenty of rest can all help reduce the severity and frequency of these cramps. You can also try applying heat or cold to the affected area or doing some gentle stretches. Next, we have restless leg syndrome. Restless leg syndrome is a neurological condition that causes an uncomfortable tingling or crawling sensation in the legs. This can make it difficult to fall asleep and stay asleep, especially when you're lying down. Some people describe it as a creepy, crawly feeling like there's something crawling on your skin. It's often accompanied by an irresistible urge to move your legs. People with restless leg syndrome may also experience other symptoms such as insomnia, anxiety, and fatigue. There are treatments available that can help manage the symptoms of restless leg syndrome, such as medications, physical therapy, and lifestyle changes. Third, we have exercise-associated muscle cramps, as I mentioned earlier. These are the most common type of muscle cramps, and they usually occur during or after strenuous activity. They can affect anyone and are often caused by dehydration, electrolyte imbalance, or muscle fatigue. To prevent exercise-associated muscle cramps, it's important to stay hydrated, warm up before exercising, and cool down afterwards. You can also try wearing compression socks or doing static stretches where you hold a stretch position for 30 seconds or longer. Fourth, we have myofascial trigger points. Myofascial trigger points are tight bands of muscle fibers that can form in the fascia, which is the connective tissue that surrounds muscles. Trigger points can cause pain when you press on them, and they can also refer pain to other parts of the body. For example, a trigger point in the shoulder muscle can cause pain in the neck or down the arm. To treat myofascial trigger points, you can try massage, acupuncture, or steroid injections. Fifth, we have vascular claudication. Vascular claudication is a type of cramping that occurs when there is poor blood flow to the muscles. This can cause pain in the legs, buttocks, or thighs when you walk or exercise, and it's usually caused by peripheral artery disease, which is a condition that occurs when there's a blockage in the arteries that supply blood to the extremities. To diagnose vascular claudication, your doctor will perform a physical exam and may order imaging tests such as an ankle brachial index test or do a vascular study. Treatment options include medications, lifestyle changes, and procedures to improve blood flow to the legs. Sixth, we have deep vein thrombosis. As I mentioned earlier, deep vein thrombosis is a potentially serious condition that occurs when clots form in the veins of the legs or pelvis. This can cause swelling, pain, and cramping in the affected leg, and may also cause changes in skin color. DVT can be diagnosed with an ultrasound, and treatment includes blood thinners and sometimes compression stockings. Seventh, we have compartment syndrome. Compartment syndrome occurs when there is increased pressure within a muscle compartment, which can cause pain, cramping, and numbness. This can be caused by a variety of factors, including fractures, strains, and burns. Treatment options include surgery to release the pressure in the affected compartment. Ninth, we have hyperthyroidism. Hyperthyroidism is a condition in which the thyroid gland produces too much thyroid hormone. This can cause a variety of symptoms, including muscle cramps, tremors, and weight loss. Treatment options include medications or radioactive iodine therapy. Finally, we have chronic kidney disease. When your kidneys aren't working properly, it can cause a buildup of waste products in your blood, which can lead to muscle cramps. Other symptoms of chronic kidney disease include fatigue, swelling in the legs and ankles, and changes in urination. Treatment options depend on the underlying cause of the kidney disease, but may include medications to control blood pressure, diet, and lifestyle changes. Now that you know the different types of cramps and what causes them, let's talk about when you should see your doctor for muscle cramps. It's important to see your doctor if you experience any of the following. First, if the cramps are severe or don't go away on their own within a few days. Second, if you notice any swelling, redness, or warmth in the affected area. Third, if you have a history of blood clots or peripheral artery disease and are experiencing new or worsening leg cramps. Fourth, if you have a sudden onset of severe cramping pain in your abdomen, that may be a sign of a bowel obstruction. And fifth, if you have a fever, chills, and muscle cramps. This could be a sign of a serious infection, such as sepsis. It's also important to see your doctor regularly for checkups, especially if you have risk factors for vascular disease such as high blood pressure, diabetes, or a history of smoking. During your checkup, your doctor will check your blood pressure, pulse, and check for any signs of vascular disease. They also ask you about your symptoms and risk factors to determine if you need any further testing. Okay, so let's go through some examples of when it makes sense to go to the emergency room for cramps. First, if you're having a sudden onset of severe cramping pain in your abdomen, especially if it's accompanied by nausea and vomiting, this could be a sign of a bowel obstruction or another serious condition that requires urgent medical attention. Second, if you have shortness of breath and your legs feel heavy or swollen, this could be a sign of a blood clot in your lungs or heart failure. Third, if you re-experiencing chest pain that radiates to your jaw or left arm and lasts more than a few minutes, this could be a sign of a heart attack, which is a life-threatening emergency. Fourth, if you have a sudden onset of weakness or numbness in your arms or legs, especially if it's accompanied by slurred speech or dizziness, this could be a sign of a stroke, which is also a life-threatening emergency. And finally, if you have severe pain in your calf that occurs when you walk and goes away when you rest, this could be a sign of peripheral artery disease, which can lead to more serious complications if not treated promptly. I hope this video has been helpful to you. Please let me know if you have any questions or comments, and I'll see you next time.